beautiful people, it's your girl Frankie here. I know it's been a while, but we have some things to talk about. So today's video is not going to be super long, but it's pretty much about behavioral health and medical. So if you have just graduated, congratulations, by the way. Then if you really don't know what direction to go in, I'm here to help you. So this is behavioral health versus like LTACH or step down ICU. So these are the two. However, med-surg and ER and stuff can fall into the medical side as well. So if you were thinking with the medical side, of course you have to deal with a lot of medical stuff. So if you're a nurse that's really not interested in a ton of blood and Foley's and urine and vomiting and critical lab values and just the whole medical thing, then you may want to look into behavioral health, because I've done behavioral health and it is not as medical. So it's more so of therapeutic communication. I think it's a misconception of behavioral health or being a psych nurse. You think all of your patients are like schizophrenic and stuff like that. But in reality, a lot of the patients that I encountered, they were really just dealing with depression and anxiety because life was kicking their ass. Okay. I mean, that is the reality. A lot of them were just overwhelmed with what was going on in their lives. They felt they had no control, and, you know, in turn, it led to depression, sometimes suicidal thoughts, suicidal behaviors, and things like that. Yes, did we get the people that were on drugs and the people that were schizophrenic and bipolar, of course, but a lot of the patients I encountered really just needed a break from life. Okay, so please don't look at behavioral health like it's all just people just like jumping off the walls and things like that. It was not like that a majority of the time. So with behavioral health, you are dealing with basically communication. Now, you are assessing your patient. The difference with behavioral health is more so of a mental assessment, of more so of how do you rate your anxiety, how do you rate your depression, are you having any suicidal thoughts, any thoughts to harm anyone else. You are physically assessing them, like looking at their bodies, seeing if they have any scars or marks. You do have to do a skin check when they're first admitted. So you and another nurse will take the patient to a room, specifically with a camera, and you would hold up the blanket to, of course, keep their privacy, and they will take off one item of clothing at a time, pass it to you. You check the clothing. Usually by this time they have went to the ER and they have been sent over to us. So they're not just coming off the street to us, if that makes sense. Well, I haven't encountered that. And so they already come in scrubs, like the little paper scrubs and stuff. So it's pretty easy to do the assessment because a lot of the times they don't have anything on them. The security brings up their bags of belongings, so whatever clothes or whatever they took off at the ER, they send it to us. Okay, so you're doing the assessment and asking these questions, and pretty much if you need to get lab work, the most medical we've done is draw blood, because sometimes the ER do not draw their blood. The only time they really drew their blood is if they were intoxicated on some type of drugs or something like that. They would draw their blood just because they're trying to see what's going on medically, to be cleared to be sent to us. Okay, yeah, so that's the most medical, and I've run into a lot of nurses there, talk to a lot of nurses, and a lot of the nurses there, they do not enjoy the medical side of nursing. Okay, this side of nursing they like way better. They just like it way better. They are not interested in med-surg and all that stuff. Now, on the other hand, if you are going to like step down ICU, med-surg, LTACH, anything like that, ER, then yes, you're dealing with a lot of medical stuff. You know, you're listening to heart sounds, you're doing your head to toe assessments. If they have colostomies, you're dealing with that, Foley's, trachs, vents, critical drips. Like, it's really medical. So you have to be way more attentive when it comes to the patient, because you have to get labs, and then you also have to talk to the doctors and get things ordered. Not saying you don't talk to the doctors at behavioral health, but it's not the same. Like, it's just not the same. However, if you're not interested in that stuff, I say give behavioral health a try, just because it's not as medical. If you're not good with therapeutic communication, that's okay. You can definitely increase your skills or improve your skills once you get there and assess the environment. Really, you got to stay alert with behavioral health. You just got to be aware, because you do have patients that will like just snap, like, and just get to acting a fool. You know what I'm saying? So you have to be attentive to like behavioral changes in patients. But a lot of the patients there, they are ANO times 4. They can walk, they can go to the bathroom themselves. They can get dressed themselves. You're not doing any of that. Do they have behavioral health where they deal with more of the older population or when people are in wheelchairs and stuff? Yes, we did have a floor like that, but it wasn't as medical still as like ER or a step down, you know. So that is my kind of thing for you guys. Hopefully this was helpful. I don't know if it was helpful or not, guys, but hopefully it was helpful. But behavioral health, if you're not into doing all of that stuff, then definitely check out behavioral health, because you're not technically doing a ton of medical stuff. However, you are going to be really good at like looking at your patient and really assessing your patient just by looking at them and observing their skin. We didn't have any stethoscopes. We weren't listening to anybody's heart. However, if somebody complained of heart pain, we would check their medications to see if that's a side effect. And if push comes to shove, we would definitely use an EKG just to get a strip, depending on what the psychiatrist or doctor wanted us to do. And yeah, I mean, that's pretty much, if any emergency ever happened, like a patient passed out or something like that, we called 911. Because we was behind the hospital, even though we were part of the hospital, we wasn't inside the hospital. So we called 911. They'll come pick them up and take them to the emergency room. So it's nothing that we really had to do. So yeah, I think that's my little spill. I know this video is not very long, but it's just kind of to help you new grads or nurses that's been nurses for a while and never thought about behavioral health. If you're sick of bedside nursing and all of the stress it puts on your body, then check out behavioral health. Behavioral health is actually a really good career field. In my opinion, a lot of people, you're not really using all of your nursing skills compared to if you're in the ER or step down. But if you're not interested in that stuff, which you're not entitled to be interested in all of that medical stuff. You're not. Please don't let nobody tell you you have to do all that stuff, because you don't. I know some nurses that rather just sit behind the desk and do insurance, sit up behind the desk and call patients on their whatever, like, or work at a doctor's office. You're not really doing too much stuff there as far as too much medical stuff as in like the ER or the step down or ICU and stuff like that. So that is just it, y'all. So yeah, definitely comment down below if you are a psych nurse, if you worked in psych, the pros and the cons, and just kind of help the new grads out, because I feel like it is very overwhelming when you graduate, because there's so many directions you may want to go in, and sometimes you may already know what you want to do. But the advice I got from a dialysis nurse when I was at work, she came to do dialysis on a patient, and I was talking to her, and she had been a nurse for 20 years. And she said as soon as she graduated, she instantly done dialysis. She's been doing dialysis her whole career, and she loved it, and she knew she wanted to do dialysis. However, she said if she was to ever try to change and do something else, it would be very hard for her to get a job doing like ICU or something like that, because she's pretty much going to be a new grad because she doesn't have that experience. So her advice was to try everything. Do all of it if you can. Like, try everything. Don't hold yourself to one specialty, and increase your skills, basically. So I'm going to stick with that advice that she gave. But that is my advice to y'all now. So now we all have the same advice. And I hope you guys found this video very helpful and knowledgeable. And yeah, I'll talk to you guys in the next video. Peace.